All right, so please welcome Jeremy Grindeland and Dane Gwen. Grindeland is a senior pharmacist at Sanford Health with a PharmD from North Dakota State University. Jeremy specializes in internal medicine, family medicine, and cardiology medication management. He's a published author and earned board certification in pharmacotherapy, as well as playing a key role in launching a pharmacist-driven lipid clinic to improve patient care. Outside of work, Jeremy enjoys sailing and playing music, adding a personal touch to his impressive professional achievements.
Hey, y'all. Testing. Hello, everybody. It's great to be here. Thank you for having a time, set aside for us pharmacists. And I would agree, rocking is happening tomorrow, but who says we can't rock now with some education? So I'm thinking that's a little bit different of a type of rock, but still, I think it fits really well. It's what we've dedicated our lives to as pharmacists, and so I just have a quick portion talking about emerging medications when it comes to heart disease in the area of cholesterol management. We just have a couple different types of focuses really on the aortic aneurysm management and also other different places where you could locate heart disease due to basically plaque that's found in the artery space. I have no disclosures to be able to speak to. We just have really quick time just to talk about other medications here that are really exciting in the space of cholesterol management when it comes to heart disease. And we will also review a little bit about why those medications are important to us. Really just have to be able to put the baseline down is that with our artery plaque, we do have different ways of managing this and lifestyles that we choose and different healthy lifestyles like physical activity, and then also have great dietary recommendations for this, but also medications help keep our risks low. Overall, you can see there's a list of things that actually qualify a person for having the definition of cardiovascular disease from plaque, and that's what we call ASCVD. And overall, we have aortic aneurysm as another cause of maybe some instance of plaque. Our goals overall are no different. They are unchanging, that we lower the risk as much as we possibly can in a person. And we do that from a medication management standpoint. We reduce the amount of LDL cholesterol in the bloodstream, and therefore we say lowering the risk with cholesterol is how far can we go? The lower we go, the better. Overall, this is to prevent future events of cardiovascular disease, such as major events that disrupt the blood flow to certain vital organs. So that's, again, the ultimate goal is to avoid major heart attack, stroke, or other types of clotting issues within the circulatory system. And so as we stand kind of here today, we know the most about managing patients in our clinic. Really, when it comes to one medication alone, it's statins. And our pharmacist role really is to make sure to give you the most success on staying on medications that are going to lower your risk of heart disease and major cardiovascular events. So I have a list of those medications here. You might recognize them by their brand or generic names. A lot of them are sort of used in our heart space. A lot of them are patients we manage on atorvastatin or rosuvastatin. There's other benefits just then, other than lowering the LDL cholesterol. We do see that you can also be able to positively affect the areas where there is plaque found, which is lowering the inflammation in those spaces and also reducing growth and expansion of aortic aneurysm, which then leads to the risk of rupture lowering as well. So how to work together to make sure to be successful with taking a statin. Overall, we know that lifelong, these medications are utilized to help lower your risk as far as possible. Pharmacists are working at how the timing of these medications during the day fit in with your lifestyle. We also look at personalizing your dosing, and also we have a trial of multiple statins in that same class before we end up abandoning statins. A lot of times it's just how best can I tolerate my statin? How do I understand when it's time to mention a risk or a complication I'm having to my doctor? Well, now we have our lipid clinic where we're actually able to bring those concerns forward to a pharmacist, and maybe even having that collaboration in a real time or even earlier than you might expect through regular follow-ups or different types of touch bases that you can have with a pharmacist at Sanford. Knowing that we do have statins, they're kind of our backbone here, and we show that as a slide just for awareness. If we do not see the reduction in our LDL cholesterol like we're hoping for, we do have some emerging other non-statin medications that we're pretty excited about, but do just need some additional management alongside addition to a statin. And this is our kind of other medications we like to call Repatha or Praluent. These are two different medications that are shown as injectables, and they help enhance our body's ability to eliminate cholesterol. The mechanism is fairly direct to increase the amount of LDL receptors that we have, and that ends up promoting more elimination of LDL cholesterol. The hurdles that we have usually with the medication like Repatha or Praluent is cost and other needle-averse, types of situations where maybe patients are not so excited about having an injection. So another type of other emerging therapy we've actually seen more evidence in, and actually more importantly, in the area of preventing major cardiovascular events, is Nextolol or bempedoic acid, which actually helps in one direct way, which is decreasing the production of your LDL cholesterol, but also indirectly helping you eliminate LDL cholesterol. And how it does that is actually by way of increasing the amount of available LDL receptors in your body. Now, what that's actually shown is most recently a trial has been published to show these that are on bempedoic acid also have seen a decrease in the reduction or decrease in the amount of cardiovascular events in their lifetime, in that space of what the trial was studied in. And we're actually more excited to see how this actually works out in the long term. Now, another big hurdle that a lot of people have talked about with statins is my muscle pains or maybe more weakness in my muscles. We actually see that bempedoic acid has an ability to only really affect the liver where it works and not in our muscle systems, not systemically around our whole body. So it's actually touted to maybe be the replacement in the future to a statin medication if we're not able to tolerate a statin. So it's worth an additional conversation. I think in this case, when we're talking about these medications, they're really seen as add-ons at this point. And certainly it's worth personalizing to your current situation, the way we utilize these medications and how we get the cost to be effective, for the person in affordability. So key takeaways from my portion today is really talk about our pharmacist is very available and now much more a touch base than ever before with our lipid clinic that we have at Sanford. And now we've been learning how to work with patients even on a more of a real-time basis. We promote that, statins are still the backbone to help manage plaque in our arteries. And what that does is it prevents these negative changes from happening in our arteries that lead to more major cardiovascular events in your lifetime. There are promising therapies that help us reduce the amount of dependency on just statins alone and have good add-on treatments that are out there nowadays. And pharmacists are there to help be able to answer any questions along the way.
Thank you for being a part of the Rock from the Heart community and for joining us today. Your presence and engagement make a huge difference in raising awareness and building a stronger support network for those affected by aortic and heart valve disease. Thank you so much for attending today.